Thank you for listening to Depictions Media Radio.
Good morning. Good morning to everyone, and thank you for joining the briefing. Today I'll discuss the epidemiology of COVID in the region and in Canada, the vaccine rollout, testing, travel measures, and also mention influenza. Today there are 3 new cases of COVID-19 to report in PEI. 2 individuals are in their 50s with a history of travel outside the province. Contact tracing is complete and they are self-isolating. The 3rd individual is in their 20s and this case is still under investigation. There is a flight notification. Anyone who traveled to Charlottetown on Air Canada flight number 8332 that departed Toronto on October 15th, arriving October 16th, should monitor themselves for symptoms, and if any develop, they should be tested at one of the health PEI testing clinics. I do anticipate a couple of public notifications related to the 3rd case, and they will be issued with the release later today. We currently have 7 active cases and 315 cases since the pandemic began. And between January 1st and mid-October, 84% of cases in PEI were in individuals who were not fully vaccinated, and 16% of cases were in people who were fully vaccinated. It is not surprising that we are experiencing breakthrough cases. While the vaccine is very effective against the virus and the variants, it does not provide 100% protection. Being fully vaccinated significantly lowers the risk of serious illness, hospitalization, and death related to COVID-19. In recent weeks, the national rate of COVID-19 hospitalizations among unvaccinated individuals was 26 times higher than in fully vaccinated individuals. Being fully vaccinated is especially important for older individuals, those who live in congregate settings, and those with comorbidities and underlying medical conditions. This week, we mark another milestone, and I'm not sure milestone is the best word in our COVID journey as we enter the 20th month of this pandemic. And I'm sure that no one could have ever predicted in March 2020 that in October 2021 we would be in the midst of an aggressive 4th wave in Canada that is overwhelming healthcare capacity in some provinces. Globally, there have been over 240 million cases of COVID-19 and almost 5 million deaths. In the last week, despite the virus continuing to surge and present challenges in some parts of Canada, there has been an overall decrease in COVID-19 disease activity, with new cases down 18%. However, some of the outcome trends continue to be concerning, with hospitalizations and ICU admissions unchanged from the previous week, and COVID-19 related deaths up by 6%. Nationally, the rate of new cases continues to be highest in youth under the age of 20 years. The very infectious Delta variant accounts for 99% of all cases reported. The Delta variant has overtaken all other strains of COVID-19. In Canada, since mid-July, the rates of cases and hospitalizations have increased among unvaccinated and partially vaccinated individuals. In Atlantic Canada, cases continue to rise with 880 new cases in the past week. There are now 1,331 active cases in the region and 14 COVID-related deaths in Atlantic Canada in the last week. In PEI, we are making excellent progress on the vaccine front. As of Saturday, October 16th, 92.7% of eligible residents have received at least 1 dose, and 86.7% of eligible islanders are fully vaccinated. Earlier this month, population numbers were updated using the latest estimates from Statistics Canada. The new estimates from Statistics Canada confirm the population of PEI grew, which increased the number of people who are eligible to receive the vaccine. This population adjustment resulted in a small downward change in the percentage of people who have received at least one dose and those who are fully vaccinated. Our rates of full vaccination are among the highest in the country, and we will continue to stress the importance of immunization in the younger age groups. Right now, our rates in the under 40 age groups are too low, especially the 20 to 29-year-olds, where the rate of full vaccination is 74%, well below our provincial average. Effective immediately, pharmacists can administer the COVID-19 vaccine to all eligible individuals aged 12 and over. Previously, pharmacists were able to administer COVID-19 vaccine to eligible individuals age 18 and over. However, a recent regulatory change authorizes pharmacists to give the COVID-19 vaccine to anyone aged 12 and over. This change makes it easier for families with children between the ages of 12 and 18 to access the COVID-19 vaccine. They can now get immunized at one of the many partner pharmacies across the province. We are working with the education system and health PEI partners to explore how to increase the rate of vaccine uptake in school-aged children, as well as options to immunize children aged 5 to 11 when Health Canada approves the vaccine for that age group. In the last week, we conducted almost 4,000 lab-based PCR tests and over 15,000 rapid point-of-care tests, including over 11,500 at Borden. As we've discussed previously, our approach, and an approach that really has worked well for us to date, is to keep COVID-19 out of PEI through screening and early detection, and when we do have cases, to limit transmission in the community. To provide additional protection to those who cannot be vaccinated or who are at risk of severe outcomes from COVID-19, we implemented the vaccinator test policy for frontline workers, first in long-term care and community care, and then in schools, correctional facilities, early learning childcare centers, healthcare facilities, and group homes, etc. The vaccinator test policy requires frontline staff who are not fully vaccinated and who do not have symptoms of COVID-19 to be tested up to 3 times per week using rapid antigen tests. Beginning next week, all families in PEI with children in grades K to 6 and children in licensed early learning childcare centers will have access to rapid antigen tests to be used at home when their child has a single mild symptom and cannot access a COVID-19 testing clinic. Information regarding the distribution of these at-home test kits, including when and how they should be used, will be provided to families by the schools and early learning sector within the next week. These tests can also be used to test school-aged children younger than 8 years who have traveled outside the province and are recommended to be tested before returning to school. It's important to clarify the difference between rapid antigen tests and lab-based PCR tests. And we've been asked questions about these types of tests. While these tests have different purposes, they both play an important role in early detection of COVID-19. Rapid antigen tests are self-administered screening tests that can be used in workplaces or at home. Lab-based PCR tests are available at health PEI testing clinics. It is important to note that anyone with symptoms of COVID-19 should be tested at a health PEI testing clinic using a PCR test. And to really reiterate, the very best test for anyone with symptoms is a PCR test, which is the only test that can be used to diagnose an individual with COVID-19. Rapid antigen tests are valuable COVID-19 screening tests, but are less accurate than PCR tests. Anyone who has a presumptive positive result on a rapid antigen test has to have a PCR test to confirm the result. If a rapid antigen test is negative, it should be repeated in 48 hours, regardless of symptoms. Rapid antigen tests are ideally suited for regular and repeated screening of individuals who do not have symptoms of COVID-19, and the regular screening increases the accuracy of the test. And screening unvaccinated children who have a single and mild symptom of COVID-19 and who are not able to visit a testing clinic. Now that Thanksgiving is behind us, we have to begin thinking about influenza or the flu season. Last year, the flu was virtually not existent in Canada and around the world, thanks in large part to the public health and travel measures in place to limit the spread of COVID-19. The Public Health Agency of Canada is predicting a resurgence of the flu based on two factors: low levels of immunity in the population, given there was much less circulation of the flu last year, and the easing of some public health measures as a result of high COVID-19 vaccine coverage. All islanders 6 months of age and older are encouraged to get the flu vaccine. It is available free of charge at public health community flu vaccine clinics, physician offices, nurse practitioner offices, and pharmacies. And you can visit the flu vaccine website for details on how to make an appointment to get your flu vaccine. Individuals over the age of 65 should request the high-dose flu vaccine that is only available at public health clinics and pharmacies. Youth aged 2 to 17 can get the flu vaccine in the form of a nasal spray, flu mist, and this is only available at public health clinics. Similar to last year, we have received questions about how influenza differs from COVID-19. Influenza viruses circulate each year and are constantly recombining and changing, which is why the flu vaccine differs every year. Over time, humans have adapted to influenza, building up some level of immunity. Influenza is endemic, as it is constantly present and we live with it. The flu vaccine is meant to give our immune system a boost each year to be ready in case we are exposed to the influenza virus. COVID-19 is a novel virus with animal origins, meaning that if humans are exposed, they have little or no immunity. The virus spreads more easily between people and results in more severe outcomes compared to seasonal influenza. Vaccines are slowing the spread of COVID-19 and protecting people from severe outcomes. Despite the differences between influenza and COVID-19, the tools we have at our disposal to protect ourselves and others from these viruses are the same. Get vaccinated, wear a mask in indoor public places, wash your hands often, physical distancing, and staying home when not feeling well. In early September, in order to protect our province from potential spread of COVID-19 as Canada was entering the fourth wave, we announced that moving to Step 5 of the Moving Forward Plan would be paused and then implemented over time. Specifically, the border and travel measures, including screening, testing, and self-isolation, would remain in place until mid-October. Based on the epidemiology in Atlantic Canada and the country, these travel measures and other public health measures, including gathering limits and public health guidance, will remain in place as additional layers of protection as we continue to navigate the fourth wave of this global pandemic. The outbreak at West Royalty Elementary School was declared over as of October 10th, 14 days after the last case linked to this outbreak was diagnosed. I want to thank the students, family, and staff at West Royalty Elementary School for their steadfast cooperation and support during the outbreak. A special thanks to our public health and testing clinic partners for their extraordinary efforts during this outbreak. In hindsight, we can appreciate the importance of taking decisive and quick action to get this outbreak under control. We can also remember the tremendous uncertainty and unease we all felt in the early days of this outbreak until we were able to begin to contain the transmission of COVID-19. The Halloween guidance is posted on the website. Similar to last year, door-to-door trick-or-treating can take place with precautions. Children should visit people they know in their neighborhood or apartment building. Communal treat bowls should be avoided, and no-contact treat pickup options are recommended. Do not hand out treats if you are self-isolating or feeling unwell, and be respectful of homes who do not wish to participate in Halloween this year, and if the lights are off, skip that particular house. Everyone is tired of COVID-19, and we all want it to be over. I share those feelings, and everyone involved in the provincial COVID-19 response shares these same sentiments. As a member of our team stated recently, said, "Hang on, PEI, hang on just a bit longer. We are getting through this. The last part of our COVID journey is especially challenging. We will continue to take steps to protect the health of Islanders. We will remain focused on protecting our healthcare system so that services are there for Islanders when they need elective procedures as well as emergency, critical, and palliative care services. As individuals, the best thing we can do to protect ourselves and others is to be fully vaccinated and to continue to follow the public health measures a little bit longer. It is still important that PEI residents carefully consider the need to travel off-island. As we continue to hang on and navigate the last part of our COVID-19 journey, let us continue to be patient and continue to be kind. Thank you. And I'll open it up to questions. I don't know, if we're in the room first, I'll start with you, Wayne.
Sure. Thank you, Dr. Morrison. Maybe if I could just ask you a couple of questions around the vaccination and vaccination and test policies. Is the province seeing an uptake either at provincial clinics or our pharmacies seeing an uptake since we implemented that policy?
So overall, yes. So now I have numbers that were up to the first week really of the Vax Pass, which includes the test or vaccinate. But up until the end of last week, we saw a 12% increase in vaccination rates, and that was compared to 2% in the weeks prior. And 40% of those of that increase was in first doses. So that is, and I believe there have been another even a few hundred doses of vaccine given in the last 3 days. So those numbers will continue to show us that people are being vaccinated. So I think that was over, so last week, 2,830 doses administered, and that was more than the previous week, and over 1,100 of them were first doses.
So what's your message to Islanders who, for whatever reason, whether they don't want to get vaccinated, they're hesitant to get vaccinated, still haven't, that remaining 10 to 12%, what's your message to them?
Well, I mean, we've talked about the importance of vaccination. We talk about the severe outcomes related to hospitalization or death that are increased for those who are not vaccinated. And I think that's being shown across the country, and there's evidence, good evidence about that. We try to make sure that we communicate that kind of information. And I think we're trying to put other measures in place as well too, with our masking and public health measures, our testing, our travel screening at the points of entry. And we're all trying to get through this. And I appreciate there are concerns. There are some medical exemptions related to the Vax Pass, and for those who are unable to be vaccinated for medical conditions or have had one dose and are unable to receive the second dose. We've given out 21 of those medical exemptions, but 21 out of a lot of people who've been vaccinated, so that number's still quite small.
So there's just 21 medical exemptions so far in the province?
Yes.
Okay. And you mentioned the numbers, 92% one dose, 86% fully vaccinated. What's our goal? What do we want to get to?
Well, I think the Chief Public Health Officer of the country, Dr. Theresa Tam, has said it weeks ago. Really, it's as high as possible. And I think we've said that here too. I'm particularly concerned about some of the vaccination rates in the younger age cohorts, and I think if we can increase those rates, it helps protect everybody. And the one thing I didn't mention earlier was, we've started doing third dose boosters in long-term care and community care. I think we talked about it in the last week or two, and how important that is, as well as a third dose for those who are immunocompromised. I think we'll have some advice on other groups before the end of the month from NACI, National Advisory Committee on Immunization, just to make sure that we don't have any waning immunity in certain age groups. But with that going on, we're still trying to get as many of those in the younger age groups vaccinated to protect us all. But if we can try to get through this fourth wave here in PEI as safely as possible, I think we'll all be breathing a sigh of relief.
That's my last question, and you hinted on it about the third dose, because I know when we were at the pharmacy last week doing the flu shot story, I was shocked at the number of people who are coming to the pharmacy saying, I want my third dose. So if you're a senior right now, you can't get the third dose. Who can get a third dose? Who can't in this province right now?
Right now, based on the recommendations of NACI, National Advisory Committee on Immunization, are those who are in long-term care and community care, and usually there's a 6 months between having had their first 2 doses, as well as those who are immunocompromised. And so those are the groups. And we're waiting to hear about other groups that may be added to that booster recommendation by the end of the month.
Thank you very much.
You're welcome.
So, good afternoon. It's been a while since I've been here, so
Yeah,
it's nice to see you in
yeah,
person. I suppose first, just curious about sort of the Vax Pass. I know you touched on numbers. I don't know how much you can sort of delineate between Vax or Test and the Vax Pass itself, but how effective has the Vax Pass policy been in, I know it's not necessarily a stated goal of it, but in increasing vaccination rates?
Well, hi, Mike. I think you're right. It's hard to know how many are related just to the Vax or Test versus the Vax Pass. But for instance, one of the ways we can tell with the vaccinate or test policy is that we can watch the numbers of people who need to be tested every week change and go up. For instance, in the early learning sector, when we started, there were 189 individuals who needed to be tested because they were not fully vaccinated, and that number has gone to 130 who need to be fully vaccinated. So that means some of those individuals now don't require testing because they are fully vaccinated. So that is certainly a positive sign, and that sort of speaks, I think, a bit to your question too, Wayne, a little bit. And then in the first week of the Vax Pass, we know there was a 12% increase overall in terms of numbers of people being vaccinated, and that was compared to 2% over the preceding 2 weeks. So as you said, it's not the stated intention. Really, the Vax Pass is an additional tool, or we've talked about layer, that we will use to try to protect us all as we go through this fourth wave. And it's a limited time, we anticipate, but one more tool that we have.
And as far as enforcement of Vax Pass, I haven't seen a whole lot of stories of super belligerent customers or anything like that, but how has enforcement been going?
Well, I think we always talked about education would be the first line. There have been any concerns are being brought certainly to our office, and there's different partners. There's with our environmental health officers and liquor inspectors and occupational health. There's a number of people who are involved, and I think you're right. It's been relatively. I think people are learning and adjusting. I was asked for my vaccine pass and identification going in somewhere yesterday, so it is. I think it's going relatively smoothly, and but we're all making adjustments, and we may need to make some little tweaks to the Vax Pass as it goes through. But the QR code is expected to be up and ready by the end of the week, and then the application for the reader is supposed to be ready by the end of next week.
And do you know sort of when this education grace period will end, and when, you know, some more forceful penalties will be put in place?
Well, I mean, there's some that my understanding is that there have been a couple of situations already referred to enforcement. So I think if something needs to be done from enforcement, it's not that we're not paying attention to that, but I think some of the questions really are around just wanting to make sure they're doing, putting it in place the way it was intended. So it's really not, there's not a specified grace period per se.
and not that I've seen personally, but I've heard a few instances of maybe businesses being a little lax with other COVID protocols. So how important is it to still, maintain physical distance and do your due diligence with recording everyone coming in and that sort of thing for contact tracing?
Well, one of the parts of a Vax Pass approach, and this is similar to in other places, when people are in a venue where a Vax Pass is in place, it allows a greater number of people to be in without the same kind of physical distancing measures. There's still cohorts in place, so in a big venue there would be cohorts, but it would not have the same physical distancing requirements because of the Vax Pass. And allows some of those measures to be in place. I think it's probably important to remind people, I think we've done this so many times, whether you're vaccinated or not, we shouldn't be going somewhere if we're not feeling well, or if you're having symptoms. And I think that's important. We still have masking in indoor public places, and that's one other measure that we have. And then being vaccinated and washing our hands, all those. So I think the businesses are adjusting to it as we go forward.
Thank you.
You're welcome.
Gabrielle Tremont, Radio Canada.
Bonjour, Dr. Morrison. Alors, ma question, c'est en français pour vous. C'est que plus de 86% des personnes admissibles au vaccin de la COVID-19 cette année sont déjà doublement vaccinées. Vous encouragez les gens à se faire vacciner. Il y a maintenant les pharmacies qui vont offrir les vaccins pour les personnes âgées de 12 ans et plus. Mais quand on voit des données comme par exemple Nouveau-Brunswick, 20% des personnes décédées à cause de la COVID-19 étaient vaccinées. Alors, comment on pourrait expliquer ces données-là et est-ce que ce type de données pourrait décourager les gens d'aller chercher une deuxième dose du vaccin?
Bonjour Gabrielle. Alors, c'est une bonne question. Et puis, on sait que, et j'ai mentionné ça en anglais, qu'on sait que les vaccins sont pas 100% protectifs, mais on sait que les gens qui sont vaccinés sont 26 fois, les personnes qui sont hospitalisées, qui sont pas vaccinés c'est 26 fois plus commun que les personnes qui rentrent à l'hôpital qui sont vaccinées. Alors, et puis si c'est les personnes qui sont plus âgées, qui ont des conditions médicales à base, ils sont plus à risque. Alors, je pense que même si c'est à Nouveau-Brunswick ou partout au Canada, il y a les personnes qui vont mourir ou qui sont à l'hôpital qui sont vaccinées, mais la majorité sont les gens qui sont pas vaccinés et c'est plutôt les personnes qui sont plus âgées qui ont je ne sais pas, comme les outcomes qui sont plus sévères.
Est-ce que vous pensez que ce type de données pourrait décourager les gens de se faire chercher, de chercher cette deuxième dose du vaccin?
J'espère que non. Je pense qu'il y a beaucoup d'évidence pour mentionner il y a moins de risques d'être à l'hôpital si vous êtes vacciné, et on parle de ça, mais c'est aussi important qu'on mentionne que c'est pas 100% protectif parce que et alors c'est important de faire les autres mesures de santé publique en même temps.
Et si vous me permettez, je voulais juste ajouter une question. Vous avez dit que le vaccin n'est pas 100% efficace, mais on offre déjà cette année la troisième dose à certains groupes, comme les personnes immunosupprimées, par exemple. À votre avis, est-ce que vous pensez que d'ici la fin de l'année, toute la population éligible de l'île aura besoin de se faire vacciner avec cette troisième dose d'ici la fin de l'année?
Gabriel, je ne sais pas. Je vais attendre vraiment la direction et les recommandations de NACI. Mais j'imagine qu'il y a des autres groupes de risques qui vont être mentionnés pour avoir besoin d'une troisième dose, mais je ne sais pas, je vais attendre NACI et qu'est-ce qu'il recommande.
Excellent. Merci beaucoup. Bonne
Merci.
journée.
Bonne journée.
Steve Bruce, CBC.
Yes, good day, Dr. Morrison. Could you talk a little more about what's happened at this point to prepare for the rollout of the vaccine to 5 to 11-year-olds, and I guess what we know at this point about how that rollout is going to work?
Hi, Steve. So there was a meeting at last week with public health nursing, health PEI, and Public Schools Branch, Commission Scolaire Langue Française, and the Department of Education to discuss what some of the strategies might be that would work for the 5 to 11-year-olds, and also how the schools might feel it would be best to reach out to parents to have that discussion. I think obviously it's a little different, and parents will want to be present for the vaccination of younger age children. I'm not sure how even my youngest child would do without a parent present, so I think they're trying to figure out, what does that look like? Where would clinics be offered? What times of day would those clinics happen? So they're having those conversations and trying to. I think the plan is certainly to do some reach out as well to parent groups to see what would work the best. As you know, Steve, the Pfizer did make a submission to Health Canada, and we will await review and approval by Health Canada, and then the NACI recommendation as well.
And what's it going to mean in terms of our supply of Pfizer, given that it's a lower dosage for kids? Will you have to secure a different supply to get it to that age group?
Yes, Steve, it's a different sort of formulation for that particular age group. So, but there will be, so that, my understanding is that we will, it's not really based on our supply here, which we have sufficient supply, but we would be getting that supply nationally like we did throughout the vaccine rollout.
And you mentioned in your briefing that the vaccine rate among those under 30 is still too low from your perspective. So have any efforts been made, I guess, to understand what is stopping people in that age group from getting vaccinated, and I guess what more could be done to get that rate up?
Steve, so I think you absolutely asking the question that we've been asking the group. There's been work with the COVID vaccine committee and communications involvement as well. And that's whether we are trying to make sure that the information's available in multiple languages, whether it's individual discussions with vaccine hesitancy, whether it's trying to make sure we have the right information on the website. It's been a range of those types of things that we have looked at, and it's also why we talked to the Public Schools Branch and others about that particular less than the school-age children that are eligible and what we can do to improve the strategies we may be able to improve with their input for school-age children and the 12 to 17-year-olds. Because overall, the rate for the schools is 71.4% overall for the schools. And so I would like that rate to be higher in those eligible school-age children.
And back to the 5 to 11-year-old age group for a second. I know you can't put an exact date on it, but do you have a sense at this point, a rough timeline of when we might see shots in arms for kids, 5 to 11?
Steve, I'd love to give you a specific date, but I do anticipate we'll likely see this before Christmas. That would be what I anticipate.
And a final question, can you talk a little bit more about those at-home test kits and the circumstances where parents should use them? You know, if you, on Monday, you've got one of the at-home kits and your kid wakes up and he's got a runny nose, is that a circumstance where you should do it? And then if you get a negative result, can you send your kid to school? Or can you just kind of lay out when to use them and when not to use them?
Yes, and I think that's what we're trying to put that information together really clearly for parents. And there'll be a video that is actually I saw the draft of it, the video as well as information sheets to go out and be available for parents with some questions and answers. But it's really about one single mild symptom and where there's really not access to testing easily available. And of course, if they haven't traveled and they have no other risk factors, I think that certainly would be a possibility to use it, but then have to repeat it again in 48 hours, even if that test is negative. The best test, if you're symptomatic, certainly is still a PCR-based test at the clinic, but we know that that's not always easy for parents and to get children to those testing clinics, and in sometimes parts of, if you're living in certain parts of the province, it may not be as easy to get to a testing clinic. So I think we're hoping that these extra antigen tests will provide an extra way to screen some young people who only have a single symptom and are otherwise pretty well, recognizing there's a lot of children as we go into this season who might have runny nose for a long time.
For sure. Okay, thank you so much.
You're welcome. I think that's it. So thank you all.
Thank you for listening today, and thank you for supporting us with our sponsors. Please go to depictions.media for more information and click on our contact link and let us know how we can help bring your story and help bring us to a better world. This show has been produced by Depictions Media. Please contact us at depictions.media for more information.